what do you think's the best way for someone coming into our field to really enhance their surgical skills?
I
So I
think
think
it depends on their background, where they came from. Like maybe it was like my background was general surgery first. I think it was a great primer into the more hands-on, more invasive techniques beyond a needle. But really, just even practicing with those needle skills can be have a great longitudinal effect on how well the patient, or how well you treat that patient technically with the more advanced procedures. Because not everything that we do involves like massive suturing or staples or something like that. But having the awareness of kind of, okay, what's the worst thing that can happen here? Because you have to be prepared for those consequences. And so that can be done, like you had said, Dr. G, earlier, with just preparing for epidurals. So knowing those consequences and what to look out for before, during, and after the procedure, I think really will enhance surgical techniques, because then you'll end up being more careful. You'll avoid certain structures. You'll approach the patient differently depending on, what medications they're on or what their comorbidities are.
Yes, I totally agree. Procedural planning is huge. And then also it's just super important to get hands-on practice, right? So go to your conferences, go to the cadaver labs, spend a weekend here and there and get your hands on a cadaver and kind of practice the procedure and just refine your skills. I think it's super important.
Yeah, I think that's great to say. Like, keep going to cadaver labs too. Even if you already did one, keep going. All these companies have cadavers out there. We work with a company called VOMERS that sends us synthetic cadavers that helps us enhance our skills to dissect, to drive trocars, to do vertebroplasty, kyphoplasty, SI joint fusion, Minuteman device laterally for interspinous spacers or interspinous fusion. You can do all this stuff on cadavers. All you need is a C-arm. Come by our office. Our C-arm, at the end of the day, we're practicing on it all day. We got our X-ray techs in there. We're always practicing your surgical techniques. One thing I will say to anyone out there training in this field, know how to suture very, very well. If you're going to make an incision, you need to know how to suture. And you know, for patients out there, if you're going to go see an interventional spine doctor, go to an interventional spine doctor that does all of these new procedures. You have a lot more options. So really do your research out there. Make sure they do SI joint fusion, interspinous fusion device, spinal cord stimulation, intercept, reactivate. Make sure in the mild procedure, make sure they have all those in their uh, pocket so that they can do the right procedure for you once they've diagnosed you correctly.